keep gonna go back to the step one. So we have workflows, determination of roles and responsibilities, and then who's gonna be entering this particular data and how data is, gonna progress through, as the journey of the patient and when at the time that the provider sees the patient. So then let's get to some forms, like tools in the sense of forms and some smart, I want to say smart phrases or smart tools that could also lend itself into efficiency. And what are your thoughts about, departmentally? When I say departmentally, meaning all the staff in the clinic has, similar tools that they can utilize versus, an individualized user preference tooling. So again, this is just, we're building the blocks of what this EMR is going to look like as we're embarking, how to decide on what this looks like. So what about those? Like, when should that be? Is that the beginning, in the middle of that conversation?
It should be at the beginning of the conversation. And I have these beginning conversations quite often. And that's one of the things, if somebody doesn't bring it up, I'm going to bring it up because, of course, it is your, I'm going to say, second tool in your tool bag that you're using in the course of the day. Because, of course, everybody's going to have to fill out documentation. And we know that documentation isn't doing anything but increasing because of all of the fraud and other things that are trying to be prevented and trying to make sure that patients get the best care. And for providers to be reimbursed for what they have been done, documentation is that key element that's in there. And also, documentation is not necessarily static. Now, granted, there are some documents that do stay the same, such as your intake form. It may not change over the course of years, but it can, because it depends on what type of dynamic practice you have. And when we talk about documents, I remember this one client we had come to us, and he had it all worked out. It was really great. He had a 40-page citation of what he wanted his documentation to look like and what he wanted to do, because his particular document that he wanted, being a psychiatrist, he wanted it to be dynamic and to ask questions and to prompt certain responses from the patient on the intake. So these are the kind of things that are tools that will make either the process of bringing a patient on board easier or noting a visit. Just like with the dermatology, we've been working with some AI responses for intake and also with doing the live notes. So as a patient is being seen by the provider, of course, you've seen this in a lot of places, and we have it implemented in a few of our practices now, where they can, as they're interviewing the patient, go ahead and the system write out a note for them, or after they've seen the patient, just use a few key phrases for that visit with the patient to have the system crank out a note for them. And we've been able to reduce the time that providers spend on the note generation by 80% over the last 6 months. So there are some really great tools that you can use in order to enhance the documentation feature, but you do have to have in mind what your documentation has to be for your particular state and particular practice type that you have.